5 life-saving stroke prevention techniques for seniors over 60, backed by real medical research. When a possible stroke begins, the minutes that follow are critical, and research-backed techniques can help stabilize the body until medical help is available. One of the most widely referenced emergency actions in international stroke guidelines is the blood shift positioning technique, which encourages controlled blood flow toward the brain while keeping the body as stable as possible. This involves gently lowering the head slightly below heart level, keeping the neck straight, and avoiding any sudden movements. Many seniors are unaware that improper positioning, such as trying to walk, stand, or shake off dizziness, can worsen the situation dramatically by forcing the heart to work harder and reducing oxygen to the brain. In studies done in Japan with adults over 65, researchers found that supportive positioning reduced immediate neurological stress and helped protect brain tissue during the earliest moments of a stroke. The technique does not cure a stroke, nor is it a replacement for medical help, but it serves as a bridge, giving the brain extra seconds of oxygenated blood, which can influence long-term recovery. The 72-year-old man mentioned earlier instinctively used this method after experiencing sudden trouble speaking, and although he still required emergency care, the positioning helped him remain conscious until paramedics arrived. His case underscores a crucial fact. Stroke awareness is not only about recognizing symptoms, it's about knowing what not to do. No standing up quickly, no walking around, and no assuming the episode will fix itself. Seniors who understand this prevention-first mindset empower themselves and their families. They reduce panic, avoid harmful mistakes, and allow the body the best possible chance to maintain stable blood flow in a moment where every second genuinely matters. Equally important to emergency techniques are the daily habits that strengthen the circulatory system and protect the brain years before a stroke ever becomes a threat. A fascinating discovery from Harvard researchers revealed that a simple, 3-minute morning routine focusing on slow leg movements, ankle rotations, diaphragmatic breathing, and gentle neck mobility can dramatically improve blood flow to the upper body. These tiny actions stimulate the calf muscles, the body's natural, second heart, pushing blood upward toward the brain with greater efficiency. Seniors in long-term studies who practiced these movements every morning showed improved circulation, reduced blood pressure, and better oxygen delivery to brain tissue throughout the day. Another everyday technique involves deliberate hydration in the first hour after waking. Dehydration thickens blood, making clot formation more likely, especially in older adults. Drinking a glass of water earlier in the morning helps thin blood naturally, enhancing flow through narrow vessels. Many seniors are surprised to learn that even mild dehydration can increase stroke risk by making blood harder to pump. The combination of morning movement, breathing, and hydration creates a measurable protective effect. These habits help the brain receive a steady supply of nutrients and oxygen and reduce pressure on arteries that have grown less elastic with time. When combined with light daily walking, balanced nutrition, and reduced sodium intake, these simple actions form a powerful defense against stroke. And the beauty of these routines is that they require zero equipment, zero cost, and only a few minutes, yet their impact lasts all day long. Understanding warning signs is perhaps the most essential part of prevention, because strokes often announce themselves through sudden disruptions that seniors and families may overlook. The FAST method, face drooping, arm weakness, speech difficulty, time to call emergency services, remains one of the most effective detection tools worldwide. However, many seniors experience quieter warning signals long before a major stroke occurs. These can include recurrent headaches, unexplained fatigue, momentary visual blackouts, difficulty understanding simple sentences, tingling on one side of the body, sudden mood changes, or an unfamiliar sense of confusion that fades and returns later. These mini signals, often related to transient ischemic attacks (TIAs), are vital warnings from the brain that a bigger event may be on the way. University of Tokyo neurologists emphasize that seniors who act immediately, seeking medical evaluation after even a brief episode, are far more likely to prevent a severe stroke. The danger lies in ignoring early clues, assuming dizziness was caused by hunger, assuming blurred vision was due to old age, or believing that temporary numbness was caused by sleeping in an uncomfortable position. These assumptions delay treatment and allow underlying problems to grow quietly, sometimes for months. Seniors who understand these warning signals protect not only their lives but also their long-term independence, mobility, memory, and ability to communicate clearly. A stroke can change every part of a person's life, but early recognition can prevent the worst outcomes. Families who learn these signs together can act faster, make better decisions, and respond with confidence instead of fear. Long-term brain health depends on consistent habits that support strong blood vessels, healthy cholesterol levels, and stable blood pressure, three major factors in stroke prevention. Seniors over 60 who practice gentle recovery exercises such as slow neck rotations, deep breathing, low-impact stretching, and mindful walking maintain better circulation than those who remain sedentary. Harvard cardiologists highlight that even brief periods of inactivity can cause blood to pool in the legs, strain the heart, and reduce the amount of oxygen reaching the brain. This means that simple daily movement, 5 minutes of walking every hour, is a practical prevention tool. Nutrition plays a powerful role as well. Diets rich in leafy greens, nuts, omega-3 fats, berries, whole grains, and warm herbal teas help stabilize inflammation and keep blood vessels flexible. Seniors should also limit high-sodium foods, avoid processed snacks, and reduce sugary beverages, all of which contribute to high blood pressure, a leading cause of strokes worldwide. Sleep is another critical factor. Research shows that poor sleep increases inflammation, disrupts circulation, and raises stroke risk significantly in older adults. Restoring a calm nighttime routine, keeping the room cool, avoiding screens before bedtime, and sipping warm water or herbal tea can support more stable sleep patterns. These small choices, movement, nutrition, hydration, sleep, and mental calm, combine into a lifestyle that protects the brain for years. Stroke prevention is not a single action or one-time technique, it is a lifelong pattern of care. Seniors who embrace these habits maintain their independence, clarity, and ability to enjoy daily life. And the message is simple yet powerful. Healthy aging is possible, but it begins one small choice at a time. Knowledge saves lives, and every senior deserves access to information that strengthens their future.